Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. We have some tremendous questions as always. I had an individual that was watching me on YouTube, which we appreciate wherever you're watching us, and I said a term, ALMA, and I think that that individual spelled to me IRMA, E-R-M-A, and I was actually saying ALMA, A-M-A. So I have a degree in natural health, and a part of my studies was in Ayurvedic medicine. And a part of my studies, I read a book called The Answer to Cancer by Dr. Sharma, talking about a lot of just basic Ayurvedic principles. Well, one of the tools that we look at is called observation. If somebody has a thick, pasty tongue, that gives it's a body signal to me that you may have some toxicity in your body itself. So if you wake up in the morning and your tongue is really thick and pasty and you got to brush your tongue or whatever you need to do to help improve it, it's because your body more than likely is toxic. So I wanted to throw that out to whomever needed to hear that today. Somebody asked a question about receding gums and deep pockets and wanted to know what should I do about that. Well, what I have learned along the way is that a lot of times if you don't have enough minerals in your body, we use products for osteoporosis because your jawbone starts to get small. It's going to impact your teeth. And also I have learned from my hygienist that bacteria in the mouth could be a leading cause for joint pain, heart problems in your body. So I use a product called Agricept L, 10 drops in 4 to 6 ounces of water, swish it around in my mouth. It's just a part of the daily routine that I do. It helps balance the pH in the bacteria, keeps it to a minimum in your mouth. Somebody wanted to know about their 52-year-old brother who has Parkinsons, and he was really concerned. They was given a drug for that. Not much has changed, and Parkinson's is kind of tough. We use a product called phosphatidylcholine. What I've learned is that phosphatidylcholine helps the synapses or the little electrical connectors inside of your brain. You know, sometimes people take statin drugs and they can also have Parkinson's-like symptoms also. I'm not sure if this individual is doing that. So we don't have anything homeopathically, because you asked about that also. You got to stay away from sugar, and the most important thing is phosphatidylcholine from our perspective. You may also consider an essential fatty acid blood spot test to make sure that you have enough oil. There was a question in reference to somebody who got scratched by their cat, and they have something called septic arthritis, which is joint inflammation, pain due to an infection. Very serious, by the way. And the lady that used to cut my hair, she got scratched by her cat, and she ended up having major surgery and was not able to work for almost a month. So I'm not even sure if this is going to be in time to answer your question. You may need to have some antibiotics. We use olive leaf. If you do go on the antibiotics, you need a probiotic. Cat bites, cat scratches, very serious. Somebody wanted to know a good electrolyte balancer. So we use Celtic sea salt in our practice and a product called BioMulti Plus. BioMulti Plus is a liquid maltable vitamin. I would suggest maybe a tablespoon in 24 ounces of water with maybe up to a 4th teaspoon of Celtic sea salt. Between the BioMulti Plus and the Celtic sea salt, you're going to give your body the electrolytes that it needs. And if you're getting a lot of cramping inside of your body, you may even consider doing an Epsom salts bath. Take 2 cups of Epsom salts, maybe 3, put it in a hot tub, a warm bathtub that is not a hot tub itself, and just kind of soak there. Let your body absorb those minerals. We have seen so many people are just majorly mineral deficient. The last question, somebody said they got gluten. Apparently this person has been pretty gluten-free, and somewhere along the line they must have had an issue with gluten and it really threw off their digestive system. There's a lab that we've used, and some of our practice members have brought in the results from these labs called Cyrex labs, and they can do something called cross-reactivity. I have learned that people have celiac challenges can also have other categories where they have a problem, and one of the more common ones happen to be dairy. So if you have celiac and then you got gluten, which you don't even know why you got gluten, you really want to check out this term cross-reactivity. You may want to contact us. Once again, I'm Dr. Bob DeMaria. Thank you for watching us on another episode of Ask Dr. Bob.